A rarely discussed but highly relevant topic that causes discomfort and greatly disrupts men's sex lives is delayed ejaculation, often known as anorgasmia. But what is it? Have you heard of it? Stay with me till the end of this video and I'll explain what it's about, how it's diagnosed, and how we treat this disorder that significantly disrupts some men's sex lives. Today we're talking about delayed ejaculation. Let's get into the video. This is a topic rarely discussed. In fact, it's believed to be underreported. Many men suffer silently, thinking there's no treatment or solution. Delayed ejaculation affects about 1 to 4% of men and is essentially the opposite of premature ejaculation. Premature ejaculation is more common, but delayed ejaculation can be just as disruptive, if not more so. Before we define it, let's clarify the difference between ejaculation and orgasm. Sometimes we use anorgasmia for delayed ejaculation, but they're different. Ejaculation is the release of semen from the penis. Ejaculation is the actual fluid being expelled. Orgasm is that pleasurable sensation linked to the central nervous system. But what's the definition of delayed ejaculation? When we say it's the opposite of premature ejaculation, we're on the right track. But there are specific criteria to diagnose and treat this condition. This condition must be affecting the quality of one's sex life. When a patient can hold ejaculation for long, but it's beneficial and good for their sex life and their partners, we can't call it delayed ejaculation because it's actually pleasurable for them. However, patients who complain of ejaculation taking over 25 minutes, occurring in up to 75% of sexual encounters for over 6 months, affecting their sex life quality, are diagnosed with delayed ejaculation. What causes delayed ejaculation? But first, let's discuss the types. There are 3 types of delayed ejaculation. Patients who've always had it, unable to orgasm since their first sexual encounter. Fortunately, this is only 1% of cases. Those who develop delayed ejaculation later in life after being normal before, and those who experience it only in certain situations. That's situational delayed ejaculation. This type is usually the easiest to manage. Identifying the cause of delayed ejaculation is crucial as it directly impacts treatment. One of the most common causes we see in our practice is medication use. Today, many people take antidepressants, anti-anxiety drugs, and antipsychotics. These medications are often closely linked to delayed ejaculation. For those who saw the premature ejaculation video, antidepressants are a treatment option. Off-label use of antidepressants can help with premature ejaculation. Patients who use these antidepressants long-term, such as paroxetine, fluoxetine, or escitalopram, may experience delayed ejaculation as a side effect after prolonged use. This is a very common occurrence. So, when a patient comes in with this issue, we need to ask about various aspects of their life and not overlook medication use, as it could be related. Another cause of delayed ejaculation is aging. Aging leads to skin atrophy in the genital area. This causes receptor desensitization, potentially leading to delayed ejaculation. Hormonal factors are another cause. We particularly highlight hypothyroidism and thyroid issues, which can lead to this condition and to hypogonadism or low testosterone in both young and older patients. It may be related to delayed ejaculation. Another common cause is neurological injuries, such as in wheelchair users due to spinal cord trauma, patients with central nervous system diseases, or even those who've undergone abdominal surgeries, where significant nerve plexus denervation occurs, potentially leading to delayed ejaculation. We should also mention alcohol and illicit drug use, especially crack and cocaine. These can cause loss of sensitivity, often associated with delayed ejaculation. Now that I've covered biological and organic causes, another key factor in delayed ejaculation is psychological or psychogenic causes. We can highlight traumas and emotional blocks some patients experience. Sometimes patients are so afraid of unwanted pregnancy or STIs in relationships that it causes a mental block. They can't relax or reach climax during intimacy due to these fears. Other blocks linked to psychological factors require sex therapy. Another common cause of delayed ejaculation is excessive masturbation and porn use. This desensitizes, and often the stimulation can't be replicated with a partner. This makes reaching ejaculation and orgasm difficult. Regarding diagnosis, no machine or test can definitively diagnose this condition. The diagnosis is clinical. We talk to the patient, listen to their complaint, take their history, and consider factors related to their sex life. Then we diagnose delayed ejaculation. During the investigation, we use additional tests to find the cause, which directly influences the treatment. Some meds can help, but when there are many drugs for one condition, it often means none work well. This is true. We need to tailor the treatment individually, case by case. In drug treatment, we can also use sex therapy, which is crucial. Ideally, we combine both medication and sex therapy. The therapist will help us manage these psychological factors, traumas, and blockages that may be associated. The main medications for delayed ejaculation are cabergoline, which reduces prolactin levels, thus decreasing ejaculation time. Additionally, there's oxytocin. Oxytocin can be used as a nasal spray before intercourse to help reduce ejaculation time. We can also consider using testosterone. For patients with hypogonadism and delayed ejaculation, hormone replacement often leads to significant improvement. Also, managing thyroid disorders and diabetes, these comorbidities should be evaluated and treated if present. So folks, that's what we needed to cover about delayed ejaculation. It's a condition that greatly disrupts a patient's sex life. Let us know in the comments if you've experienced this. Share your experience with us. Don't forget to subscribe and turn on notifications to stay updated with our weekly content. Take care and see you next time.